everybody. My name is Dr. Julie Zweig, and I'm so excited to be here live on Facebook. This is actually my first time, so forgive me if I make a few mistakes. I'd like to tell you a little bit about my journey. I have recently started a practice called Julie Zweig, MD, Integrative Sleep ENT, and also Z Wellness. I was with my former practice for approximately 21 years, and they were a good 21 years. But I felt like I had more to offer. I am a dual-boarded ear, nose, and throat doctor and sleep medicine doctor, and I've been practicing ENT and sleep for 21 years. With my patients, I have been practicing traditional medicine, traditional surgery, and looking at how to treat them symptomatically. I focus a lot on sleep apnea and insomnia and diseases of that nature, and I'm able to treat people with minor surgical procedures in the office, sleep studies, etc. But with speaking with my patients, I felt that there was more that needed to be done. We really needed to look at the whole person. And I began my journey to look at integrative and functional medicine and hormones, and wanted to see if I can incorporate that into my current practice. It was difficult to incorporate it into the practice setting that I was in, so I decided to set off on my own journey and create my own practice. So what is functional medicine or integrative medicine? It basically looks more at the root cause of disease, and it looks at how our bodies can be affected by the environment, our lifestyle choices, and our genetics. And all of these interact together to create the whole person, and we can actually affect changes in all of those systems and help prevent disease. So let's look at sleep, for example, since it's my specialty and I happen to love it. So sleep is affected by your weight, it's affected by your hormone balance, it's affected by your nutrition, it's affected by our environment that we sleep in, and it is also affected by other lifestyle choices in terms of how we approach sleep itself. When we have problems with sleep, such as obstructive sleep apnea, that can affect our blood pressure, it can affect our heart rate, it can affect fatigue for sure, it can affect our metabolism, it slows it down, it can affect our insulin resistance and diabetes. It can lead to problems with depression and anxiety, cognition problems or memory problems, and a whole host of other issues. So we can't really look at those in a vacuum. We really need to look at the whole person. And so what I'm hoping to offer in my practice is to be able to integrate what I know as a board-certified sleep physician and ENT physician in terms of the anatomy, in terms of how to interpret sleep studies, in terms of how to take a good focus history and physical exam, and incorporate that with some of the functional medicine tools and integrative medicine tools that I have been getting advanced training in at this time. Hormone replacement is also something that I'm working on as well, and that will have a big impact on sleep. As we get older and our hormones change, this also affects our sleep patterns. So that's all I wanted to do today, is to give you a little insight into my journey and tell you how excited I am to start this journey with all of you. And I look forward to seeing you. You can find me at juliezweigmd.com or email me at info@juliezweigmd.com. Thank you so much, and it was wonderful to see you.